सेंटी नहीं होना.
These are very interesting times, ladies and gentlemen, and by interesting I mean scary, strange, and lonesome. Usually, I have Umer, Fasie, and Ismail Farouk with me in the studio every time we film one of these podcasts. But unfortunately, today I'm all alone, as you can see with the new setup. Um, and the reason being, obviously, is that we're all self isolating in our homes. We're staying away from each other. The situation right now with the coronavirus is getting worse by the day everywhere in the world. Just for some context, if you look at the Dawn News front page today on the Dawn News website, as of the time of the recording, there are 645 confirmed coronavirus cases in Pakistan. There are 4 reported deaths, 292 cases in Sindh, 152 in Punjab, 10 in Islamabad, 104 in Balochistan, 31 in Khyber Pakhtunkhwa, and 56 in Azad, Jammu Kashmir, and Gilgit-Baltistan. Needless to say, this is growing, this is expanding by the minute, it's only getting worse. And we thought it would go amiss if we don't talk about this on the podcast, and if we don't try to gather our resources and try everything we can to try and bring to you the right kind of conversation that we need to have. Because right now, because of this pandemic that is plaguing the world, and the world pandemic is very important because it literally implies a global turnover due to a disease that is now being effective everywhere. Because of this pandemic, global markets are crashing. Because of this pandemic, the world order as we know it is being restructured. Because of this pandemic, everything that we know and hold true in terms of the assumptions for things to work are now finally falling apart. And needless to say, this is something that we have anticipated. This is something that, this is not something we've anticipated. We anticipated total war. We've anticipated a nuclear holocaust. We've anticipated a lot of things, but not this. And just so we can talk to some of the experts around the world, we'll be using our capabilities to talk to them through video calling, of course. And for today's podcast, we have Dr. Mashhood Qazi, who's currently working in the UAE. He's otherwise based in the UK. He's an emergency medicine consultant. He's previously worked in the Royal London Hospital. He has a master's in public health and is currently working in the Al Ain Hospital, which is the designated center for coronavirus in Al Ain. Thanks so much, Doc, for joining us. And Doc, just right off the bat, what can you tell us about this virus? What can you tell us about what this virus is like and just why people should be taking it seriously?
Thank you very much, Danny, for inviting me. I think going through your podcast platform is one of the most important topics currently
Yeah.
we should be focusing on. The reason coronavirus or COVID-19, as we know now, is so has been taken so serious in certain parts of the world is because of its high mortality rate. By mortality rate is but mortality rate, I mean, is the cause of death it causes. Mostly, if you look at the elderly population, about 50 and 60 years old, who got multiple medical issues with them, either diabetes, hypertension, or heart problems, which are quite prevalent in our part of the world,
Yeah.
in Pakistan.
Yeah, very prevalent.
And the death rates just shoots right up the roof. Whereas it's not found to cause that much high mortality rate in young population. Now, it has been compared with being just a flu-like symptom, but it actually isn't just a flu-like symptoms. The basics of COVID-19 is it's a mutated virus. By mutated, I mean it's RNA or the DNA, which is the basic genetic structure of any living organism or a virus or bacteria. It constantly changes shapes or mutates. And this is where the problem comes to the medical fraternity because they can't find any cure of it up till now. In spite of the billions of dollars being pumped in the pharmaceutical and research industry, we're still at a ground zero as far as the vaccines or the medication is concerned. Unless it's taken seriously, it's got dramatic effects. We're going to talk about later on the examples of how COVID-19 has been dealt at different parts of the world, such as China versus Europe versus US versus our South Asia. and you can clearly see the wide variations and the success and failure ratios in different parts of the world.
Yeah, I mean, we're still waiting on a vaccine, and people are hoping. I mean, a lot of people are thinking. Like I spoke to somebody yesterday who said, "Oh, like I can't wait until it's 2 weeks from now, and I'll be back outside playing and doing all the things I did otherwise." Is this true, Doc? Are we just gonna get a vaccine in the next 2 weeks, or is it gonna be a little longer than that?
No, I think vaccines at least 6 months down the line, 6 months plus. But how it works is they normally do some laboratory testing. If they have some successes, they don't directly bring it to the human market. They have to do some researches. They have to do randomized controlled trials. Even if it's on a limited basis, they have to do it before they can implement those vaccines
Yeah.
into the human circuit.
So yeah.
And that takes at least a few months.
All right.
That takes at least 6 to 12 months.
So there's got to be human testing, and then the vaccine's got to be readily available, and then it's got to make it to parts of the world like Pakistan for this to finally come to a stop. But until then, what does it look like? Is it just self-isolation and human distancing, or?
I think the reason China won this war on COVID-19 is because they got a lot of previous experiences. The COVID-19 or the coronavirus 2 is actually a sequential of coronavirus 1, which actually came in 2002, 2003 in China, and it infected 8,000 people. At that time, how the Chinese won the war was they isolated and did strict contact tracing with the infected people. So they had a lot of experience when this COVID-19 came around this time in December 2019. So immediately, even though there was a delay of 2 3 weeks before they could recognize the severity of the disease, but as soon as they did it, they did complete lockdown cities after cities, and that's where the game was won by the Chinese.
So yeah.
Yeah.
No, sorry. Go on.
I think self isolation, as you mentioned, is the key. The prevention is better than cure. We know there is no cure at the minute. There's theoretical cures, but no practical cure for COVID-19. There's supportive care for COVID-19, but there's nothing to eradicate COVID-19. So prevention is much better than cure.
All right. And, like we see Pakistan right now, and we see exactly what kind of a situation we're in right now. And I'll lay down the context of exactly what's happening here. There have been cases, there have been deaths, but the overall sentiment, at least for certain parts of the society, I mean, we can't generalize, right? We can't say that all of society or certain people or all people within certain groups of society are not following the social distancing measures, or the fact that you're supposed to stay home and not go outside. But ever since it was announced that educational institutions and all other kinds of non-essential institutions and places where people can go ahead and gather are going to be shut down, people almost took it as if it's a holiday. Like, wo chuttiyan manane nikal gaye the. There's a lot of people, if you go to the malls that weren't closed down for some reason in Punjab, if you go to the parks, if you go wherever, people are just, having a good time. I don't think people understand the severity of exactly what's happening, but can you blame them for this? What are we supposed to do to make people realize that this is really, really bad?
I think what we can do is we can do as much as we can to make people aware of how severe this disease is. Now, there's one way of blaming the government on this, but the government can do as little as they can. But at the end of the day, it comes down to individual people and the responsibilities they're going to take. Now, we don't live in a dictatorship. We live in a democracy, and somehow people have taken upon themselves that they can choose their own fate. But you have to follow the government instructions.
Yeah.
You have to keep away from public places. You have to break the cycle. You have to stop the spread of the disease. You have to stop being the carrier of the disease.
Mm-hmm.
You have to stop infecting your own family members, especially the elderly members. Me and you might not be affected by COVID-19 that much, but me and you might be the carriers of passing on this bug to our elderly family members or the very young child who don't have that immunity. Even though we might not know it, but we might be responsible of causing a significant harm to our family members. Not just family members, I'm talking about extended family, friends, and the general population as a whole.
Yeah. How easy is this virus to spread?
There are different schools of thought. If you do come in contact, I mean, in close contact with the infected person, and if he causes and sneeze in front of you, and this infection is primarily a droplet transmission. So if the droplets go directly onto you, it will definitely infect you. But the other problem we are facing is, even though you don't have a direct contact, you can get infected by the indirect contact.
Okay.
Like, I mean, if you sneeze on the table, but I wasn't there, but after a little while, after half an hour, I came round and sat on the same table in the mall where you were there, and I touched on the surfaces where the COVID-19 was there already, and then I will get infected easily.
You're right. Right.
Now it's in the aerosol on the air spaces, it's tend to survive a couple of hours easily. So wearing a mask prevents, to a certain degree, to a great degree, transmission into the other person. So wearing a mask, wearing gloves, using sanitizers are very effective, simple measures against this COVID-19.
All right.
And obviously, distancing yourself is essential.
All right. And, a lot of people don't realize this, but the COVID-19, you don't show symptoms often up to, now see, there's a lot of conflicting, narratives on this as well. You don't show symptoms up to 2 days. You don't show symptoms up to 4 days. You don't show symptoms up to 7 days. You don't show symptoms up to 2 weeks. Which one is it?
Sure. Now, all of these are correct. Now, it all depends on every person's immunity. By immunity, I mean, if I'm fit and healthy, I've got good lungs, I'm not a smoker, I don't have any underlying disease, this virus might not affect me for 7 to 8 days. It might still be around me. It will not infect. But if I'm somebody who's a smoker, who's above 50, who's got multiple high blood pressure or diabetes medical problems, it might just manifest itself within 3, 4, 5 days.
Right.
So the total, as a whole, the incubation period or the infective period of this virus is 14 days. That's why you might have heard of people being quarantined for 14 days, because that's been taken as a benchmark for 14 days. But going back to your question, how many days will it take to show symptoms? It just depends on individuals' immunity levels.
Right. Okay. And there's a lot of a lot of people are thinking along the lines of this ending. Like I said before, like this ending in 2 weeks, a month. Some people think this is a hoax as it is. But I think one of the interesting things I read is that this is just starting. And when it comes to viral diseases and pandemics like this one, you don't really understand the full magnitude of this until time goes on and on, right? Is that true?
I think, Danny, if we still contemplating the synestheticity or the efficacy of this virus, I think we should just shut it down now, because in Italy, if you look at it, the thousands and thousands of people who have died. And what they're doing is they're not even letting family members coming close to the dead people's bodies because they are infected. They're directly taking it to places where they're burning the bodies.
Wow.
Because that's the only way. So now, if you're still debating at this time and age, up to 22nd of March, if you're still debating how bad COVID-19 is, I think we're living in a doomed world. We have to wake up to the fact that it's here. COVID-19 is here, and it is one of the biggest single threat to mankind at the present time. It's not an influenza. It's not a simple flu-like symptoms. This is a virus which is mutating. Now, COVID-19, this coronavirus too, was in animals for who knows, months and years. But somehow it mutated in November, December 2019 in Wuhan, a wild animals market. It got transmitted from animal to human because might be somebody ate that wild animal. And from there onwards, nobody knew it could do human to human transmission. And then the virus mutated itself and started doing human to human transmission. And then the first thing was it will remain in China, but now because the globalization world we live in, people travel frequently. Now you see it's in every part of the world. The reason you're not seeing that much cases in Africa is because they don't have the COVID-19 testing kit available there on the masses. If they have, they will have these cases. In India, the reason you're only having 200, 300 cases because they've only tested 1,200 people. In a 1 billion population, they've only tested 1,200
Oh my
cases.
God. Yeah.
So this virus is there in the community.
Yeah. And again, back to that, just that. I mean, in Pakistan, even, there is, like I said, the start just yesterday reported 462 cases. This is 462 of the people that have been tested.
Yes, exactly. So nobody knows how many are there in the community, right? Because the healthcare, we know Pakistan healthcare system cannot handle a pandemic. We just cannot handle a pandemic.
All right.
On a regular day, we don't have ICU beds available for general poor people. We don't in government hospitals. If you're a private person who's got some cash with you, you might get an ICU bed, but still, if you have cash with you, to get an ICU bed is a big deal.
Yeah.
Just imagine if thousands and thousands of people get infected with COVID-19 and they need ICU ventilators. There's just no ICU ventilators. So this is where the problem lies. We have to stop the spread. Now, Danny, we cannot completely stop the spread. We can slow the spread. We can flatten the curve of spread.
Yeah, what do you mean
with
by
the
that?
hope, when the hot, yeah. Now, if you don't take any precautions, if you don't do any social distancing, if you don't wear masks or gloves, this virus will spread. It will hit a plateau, okay? And it will just keep on spreading. Now, the idea is by taking all these precautions, we need to flatten the curve of spread. Instead of it going up, we need to flatten it out with the hope then when the hot, humid summer weather comes in, it might further slow down the curve. Remember that WHO has said, don't anticipate the summer will kill the COVID-19. It might slow the spread further down. The idea is to slow the spread so the community or the people develop immunity against COVID-19.
Right.
But to develop herd immunity or immunity, you need time. You need 1 to 2 years for people to get exposed, their body to react and develop antibodies. So we need time for people to develop immunity. And we also need time to develop medications, vaccines. So what we're asking for is slowing the spread. We cannot stop the spread.
Yeah.
Two different things. We are slowing the spread. And everybody needs to work on this.
And I also read somewhere that the more you delay social distancing, the longer you will have to do it. If you think about it, it makes a lot of sense to me, at least.
Yeah.
And also, I saw these public awareness posters. I was driving, I think day 1 or 2 of Corona. I was going to the pharmacy. I saw one of these posters which said, coronavirus cannot survive in hot temperatures, so drink lots of hot water. And it had like literally 23 degrees Celsius written next to it, which is the temperature of Lahore right now. So that was pretty confusing for me. But that's not true, is it? Corona does survive in hot temperatures or hot water.
Of course it does. So you can see, no. Now, the one school of thought is this: why when the hot weather comes in, this virus might just mutate and become resistant to hot weather.
Yeah.
So we slow the spread. That's all what we need to do at this. Focus on slowing the spread.
And we talked about Italy just a minute back. Now, if we compare Pakistan and Italy, right, the first case detected in Italy was 31st January. In Pakistan, it was 26th Feb, if I'm not wrong. 23 days later in Italy, there was 150 cases. And in Pakistan, 23 days later, there's 453 cases. 50 days later in Italy, there's 41,035 cases. And 50 days later for Pakistan will be on 15th April. Clearly, we are at least tripling what Italy had in its first 23 days. But considering Italy also followed similar kind of a social context and similar kind of seriousness to the problem, which was not immediately shutting down restaurants and malls and all of that. What do you think? Are these graphical and statistical comparisons between Pakistan and Italy fair? Are these like accurate? What do you think is going to happen?
I think they're absolutely fair comparisons. Now, first we need to compare Italy and Pakistan. Italy is a much bigger country, much better GDP. It's a much wealthier country compared to Pakistan, right? And it's got a very well established healthcare system. So if a established healthcare system cannot compare, we cannot just compare the healthcare system with Italy, full stop. We're just miles away from there. Now, Italy government also issued the same warnings which our government is saying. Stay away, maintain social distancing. But nobody heard them. Nobody listened to them. They continued going to pubs, they continued going to their parties, they continued going to the malls, they continued going to the shopping. And look where they are now. The thousands and thousands of deaths happen, unfortunately, in Italy, and there is no treatment for this. And the comparison you've made with Italy and Pakistan on the initial phases of the spread, it is quite concerning because Pakistan is following quite a similar trend towards Italy. The reason the numbers are so low in Pakistan is because the testing is very limited. Again, being a third world country, we don't have the resources to test most of the people who should have been tested for COVID-19 to prevent the spread. So the limited number of testing we have done, you can see the numbers are really, the percentage, the testing and the outcome is quite high in Pakistan as compared to the rest of the world. But we can still stop the spread, we can still slow the disease spread, and we can flatten the curve by taking it very seriously and taking all the right precautions. Now, you can compare this with not just Italy, with UK as well. UK initially took it extremely lightly, the COVID-19. They said, okay, it's just an influenza. We're going to make sure, we're going to take it very easy. We're going to take it very lightly. We're going to develop what the word herd immunity is. They use this term quite frequently. But now things have got out of control of UK. The NHS is struggling. They don't have any ICU beds. They don't have preventions. People are still not listening to them. They're still going out. So the next hotspot is not going to be Italy. It's going to be UK. And then Iran, you can see, Iran is next to Pakistan. You might have seen a few of the people who went to the pilgrimage in Iran got quarantined. But those are the ones which we know of. There are multiple hundreds of pilgrimages which came before and also after undetected, and they were potential carriers of COVID-19, and they have infiltrated different communities in Pakistan. So, so the answer really is we need to slow the spread of the COVID-19.
Yeah, that is pretty much the answer to, I think, just about anything right now. Because this is what we can do, right? We can't really, us civilians can't really come up with a vaccine. We can't really, sit here and think that we're gonna find some kind of a cure. The most we can do is distance ourselves from others. And if you think about it, this is a pretty easy thing to do. I mean, it's easy for me to say with all of the privilege that I have that all you have to do is sit inside your home and then wait, right? And it's not that easy to do for people who are less privileged within society, right? So there's been a lot of debate over whether a complete lockdown and a complete curfew is something which is feasible in Pakistan because of our economically damaged economy, essentially, right? We can't really make people stay inside their homes because that's going to be a detriment for these people, as well as the government that's not going to be able to cater for all of these people, right? How do we solve this dilemma? We want to make people stay at home, but we can't impose it because if they stay at home, we can't get to them the requisite, supplies needed for them to survive something of an isolation.
I think that's the balance what the government needs to think about. Now, at one hand, they're concerned about these very poor people who live on a daily wages, right? And on the other flip side, they're happy to take the risk of not locking down. But if you don't lock things down, but what do you mean by lockdown? Lockdown essentially is like a curfew, right?
Yeah.
So people are not coming out of the houses. Only one person is allowed to go and get the shopping done. But the problem is, if you don't impose those rules, you are taking the risk of infecting those very sick and poor people who cannot afford healthcare. If they get infected with COVID-19, they don't have the money to eat. Forget about getting medications or taking bills for hospitalization. Um, so it's a fine balance. I will still think in the bigger cities of Pakistan, we should do, uh, we should just stop, we should impose fines on people who are gathering, even in malls or eating places. Um, I think it's going to be difficult to police it because Pakistan don't have the resources to police it. I think, like other countries, military was called in China, Italy, and now UK is calling up the military. It's no embarrassment to ask Pakistan Army to step in and impose this law.
Not at all. I mean, they've been around for years now. If you think about it.
Yeah, and I think if we can't stop this pandemic now, we're hitting a disaster zone.
Yeah. And the thing is, like, the counter argument for a lockdown or just some kind of a curfew and asking people to stay home, forcing people to stay home, is that there's a big economic cost. I think the economic cost triples or doubles if you let people stay outside, and then they catch the corona, and then there's absolutely nothing that you can do to stop, or help them getting better from the virus. But also there's a big gap in terms of the capacity building that the government's doing, right? So the government needs to have more capacity to be able to deal with this kind of thing. They need to have hospitals, and makeshift clinics just where people can you tell us about that?
But yeah, that in an ideal world, yes. Like China built the whole hospital in 5 to 7 days. They did it because they had the manpower, they have the wealth to do it. Pakistan, unfortunately, don't have either of these. They don't have the wealth and they don't have the resources to do this. So I don't think Pakistan is at that stage. They can just chuck in all the healthcare resources in and provide everyone the healthcare they need. Unfortunately, this is not the case. We have a very limited healthcare system. Even their news that the doctors and nurses are not having adequate personal protective equipment in the hospitals in Pakistan, not just Pakistan, all over the world, because they are at the forefront. They have to have the appropriate PPE. I think it comes down to the same question: what should we as a nation do? And I think the best thing to do is do social distancing and stop being the carriers and stop breaking the chain of spread.
Right.
Because the last thing me and you want to do is be responsible for transmission of COVID-19 to one of our family members.
Right.
And then hoping that there is a healthcare system which can cope with the pandemic, which actually there isn't.
Yeah. The only way to stop the spread of this disease is to pretend like you have it. And I think one of the biggest things is that...
I think that's a very, Danny, that's a very well said thing.
Oh, thank you.
To prevent COVID-19 is to think that you are a transmitter of the virus.
Yeah.
You need to stop the transmission.
Yeah, stay home, stay isolated, regardless of whether or not you have symptoms or not. And like the social setup of Pakistan, if you look at it, and especially the family setup, is such that people who are my age, 23, about to turn 24 in May, I still live with my parents. I'm in my parents' basement right now. You know what I mean? I don't move out at 18 and get my own little apartment with other 18-year-olds or 19-year-olds and then live my life as an independent adult. I'm a dependent up until, the point where if I leave the country or something to that effect. So it's really even more dangerous for us who live in Pakistan to think that we can go about and do whatever and then come back home, same place where our parents live. And that is the height of irresponsibility, I think, especially considering, like you've pointed out, this affects people of an older age bracket so asymmetrically,
Yeah, exactly. So if you look at the data in UK, 80% of the deaths which has happened because of COVID-19, there's around about 150 deaths now, have been more than 60-year-olds, more than 50 years old. So what is the data suggesting you? That elderly people are more at risk, and you rightly pointed out the social setup or the joint family or the close-knit communities we live in Pakistan is we are exposed, we are interacting with our elderly relatives. So even though the elderly relatives are not going out of the house or socializing with in the malls or the restaurants, but we are actually unfortunately being the carrier of the disease and passing on to them. And then if unfortunately they do get infected, we don't have the healthcare to back it up. We simply don't have the healthcare to back it up
Yeah.
in Pakistan.
So we can't rely on getting sick and then getting better, because if you get sick, there might be no getting better.
Exactly. That's how we need to portray to the general population, because I don't think we can live in the myth or the in the world where we think COVID-19 won't touch us.
Yeah.
COVID-19 is there. It's a reality. It's come to Pakistan and it's there to stay.
Yeah.
It is not going away. It is just not going away.
Yep.
And unfortunately, there's no easy way out of this.
And initially, when we first started this podcast, you said we're going to talk a little bit about Italy compared to Wuhan, compared to the United States. So Italy right now is in a complete lockdown. Of course, it's probably now the world leader in the most corona deaths, the most corona cases.
Danny, let me point out that the number of deaths in Italy has bypassed the deaths in China. So China had a less number of deaths compared to Italy. And the reason Italy is facing this disastrous situation now is actually that it's going to keep going up in Italy now. Their healthcare is saturated. They cannot provide any more healthcare. And the people who are infected now will just have to, unfortunately, pass away. It's just the way it is, because the healthcare is saturated now. The reason Italy got themselves in this situation because they did not listen to the government initially. They did not practice social distancing. They did not stop going to gatherings, malls, restaurants, pubs, which is exactly what the Pakistan government is asking people to do at the minute.
Yeah. And finally, steps are being taken in Punjab as well, because up until maybe 2 days ago, malls in Punjab were still open, restaurants in Punjab, dine-in was allowed, people were going. If you step out and if you, like I've had to leave and go to the grocery store, the clinic at least, once every day since this started. And if I would drive past maybe one of the commercial centers or whatever, commercial sectors, or one of the malls, I would see there's a lot of people. So I guess more than just asking people not to go, finally there have been steps taken to stop the international flights coming in. There's a lot of there's steps being taken to close down the malls and restaurants, at least for this long weekend, I've heard. But yeah, that's good. I mean, Wuhan was an interesting case because this is where it started. And then I saw videos of the doctors taking off their masks for the last makeshift clinic to close. Walk me through exactly what happened in Wuhan, and how is that different from Italy, and what were the factors in China that are different compared to those in Italy, and what led to essentially Wuhan recovering so many people within its corona pandemic situation?
I think, Dani, the difference is quite obvious. When the Chinese people or the government say something to their people listen to it. Whether they are afraid to listen to it or they do it in a nice way, but they listen to the government. When the government made the decision that Wuhan going to be in a lockdown and only one member will go out maybe once a week to get groceries and the rest of the family will stay in the house, everybody listened to it. They listened to it because China had seen the disasters of these infectious diseases in the past as well. And so they had a lot of examples. And I clearly remember when this started in January and Wuhan went into lockdown, people were actually making fun of Wuhan and Chinese government. They look what they're doing. They're really scared of what's a simple flu-like symptom. And now the people who are making fun of these, look where they are. They are really struggling now. You can take the example of US as well. US initially took COVID-19 extremely lightly. And now COVID-19 is there in US. New York is on a literal lockdown, and California is going to be next one, Baltimore, and things. And now the good thing in Wuhan is people listen to the government. They took their own responsibilities that we're not going to go on spread the disease. We're going to stop the transmission of the disease. And the benefit of one of the most benefit Wuhan had, they had a healthcare system which had infinite resources. They could build hospitals within 5 to 7 days. They had all the PPE resources available at the doorstep, which unfortunately is not there, not even in US. In US, 27 million people don't have healthcare insurance. 27 million people cannot afford simple drugs, medications. So imagine if this COVID-19 spreads in those communities, in those ghettos, in those low socioeconomic regions in US where they cannot afford healthcare. And the healthcare system is totally different compared to other countries. It's a private healthcare
Yeah,
in US.
yeah.
So the US is heading towards another disaster. Um, People who laughed at China need to learn from China. They need to learn the example what Chinese people have done, how the government has implemented those.
That's very well said. And how would you rate? Uh, well, I'll give you a list of the. Well, I'll give you two leaders actually, two very famous leaders right now, and I want you to rate their, job evaluation, so to speak. You're rating their jobs in handling the coronavirus. So first is obviously President Donald Trump.
But I think Donald Trump is more of a reactive person. He makes he takes things very lightly, and when things gets heated up, then he becomes very anxious. I think what needs to do is he needs to learn the example of China, how China learned. No matter how much he likes Chinese people, he needs to learn the example how China tackled COVID-19.
Really quickly, what do you feel about China? Donald Trump calling this the Chinese virus?
I think it was sheer ignorance.
Yeah,
This virus could come anywhere in the world. It's just a mutated virus which made its way from wild animals to human transmission. You can't blame Chinese people. It's just the virus which was there at that part of the world. It could be anywhere in the world.
yeah,
Uh, it's like blaming the whole Africa for HIV.
yeah.
You can't blame certain parts of the world
You'd call it the
where this
monkey
virus is.
disease. Yeah. So,
Yeah,
jeez.
but it shouldn't.
Yeah.
I think it's a big reality where everybody has to gear up for this.
And now, what do you think Prime Minister Imran Khan has done so far, and what do you think? How do you feel about his handling of the situation? How do you think it could be done a little differently if you were in his shoes?
So, see, Pakistan was in a very good position because it had a prime example of what was happening in China, how China tackled it, and on its western border, it had the prime example of how Iran handled it. That Iran handled totally different to what China handled. You can argue that Iran did not have all the resources because of Western sanctions. They couldn't get the medical staff, but the people weren't, you know, uh, practicing social gathering in Iran as the Chinese were.
Yeah.
So Pakistan was in the middle of two great examples. One a very good example, the one not a very good example. Pakistan should have taken a sort of a medium high ground. It should have stopped international flights straight away, but they were 2 3 weeks late in stopping those. So they allowed people from UK or rest of the world to enter Pakistan. And listen, Danny, the screening at the airport, they're not doing COVID-19 testing. They're just checking the temperature. I could walk through an airport being a carrier of COVID-19 with a normal temperature. And if you check my temperature, it will come back as normal, but I will be a carrier of COVID-19. So that the thermal scans or checking the temperature, I think is of no good. What you really need to do is you need to do COVID testing at the doorstep, at the airports. Checking temperature is not screening for COVID-19. So what Pakistan did for 2 to 4 weeks, it allowed a lot of influx of people from rest of the world to come within Pakistan and get themselves distributed in different communities, and they were potential carriers of COVID-19. Only now, a couple of days ago, they have stopped international flights. But I think they missed the ship here. They should have done it 4 weeks ago. And still, the government is reluctant to do lockdowns. Even in big cities, in densely populated cities, they have to do this. There is no way out. They have to practice this. Pakistan people don't listen to just advice or awareness. They only listen to hardcore policing
Yeah.
or military. So they have to do this. They have to implement this before it's too late. Before this gets out of proportion, God forbid, before we become the next Iran or Italy, the government needs to take sensible decisions. They have the examples in front of them.
I mean, I heard that in Italy, I read somewhere that as grim and as dark as this sounds and as disturbing as, just the thought of this is, but in Italy, it's almost as if they're choosing who to let go of at this point because they don't have a
That's true.
capacity.
That's true. No, that's true. That's why I said the healthcare is saturated. A number of deaths will actually go up in the next few days because Italy cannot handle it. They don't have the resources, ventilators. They're all used up.
And talk to me about Alain. What's it like there right now? What's it like being in the trenches, so to speak? Because, quite frankly, if I'm being completely honest, right now, you and all of the people in the world like you who do what you do are our soldiers right now. So what is it like in the trenches right now battling this virus?
I think UAE is in a very unique position because it's got very good health resources. It's got infinite number of resources, and they have actually implemented those at the ground level. So if you come now, the flights are cancelled. But if you were coming to UAE last week, everybody was getting COVID-19 testing done at the airport, and there were very strict measures. And people here are very well aware. The very good thing of UAE, people have awareness. They are practicing social distancing. They are not gathering in malls. If you go to malls now, it's completely vacant. One of the big features of UAE were the malls, whether you go to Dubai, Abu Dhabi, wherever you go. But now people are actually practicing social distancing because they're very well aware. They don't want to be transmitters of disease to their families because the family setup is quite close to what is there in Pakistan. The family lives together. They're very close-knit families. They have elderly people in their own family members. So they are practicing avoidance of transmission. And this is where UAE is much ahead from the rest of the world.
All right. And in terms of like the amount of cases that you've seen, is it a rapid growth? Is it slowly, is the number slowly coming down? What is the situation like in terms of your day to day, and what is that like?
I think we are just flattening the curve. Uh, I think this is what we want to achieve, flatten the curve so we can slow the spread of the disease before we can get some vaccines and the medications becoming available.
Right. And Doc,
And
yeah,
now you
sorry.
must have heard, yeah, sorry.
No, go on.
The three ways of handling this disease. Either you um, if the first one is whether your community has the immunity to fight this disease, which we don't have because it's too early. The second, you have the vaccines or medications to handle this pandemic, which we don't have. The third thing is the prevention, and that's the only thing we can do. We can prevent and slow the spread.
Right. And Doc, I'll let you off in just a few minutes. I just want to ask you, you know what I mean? As somebody who is right now self-isolating, obviously, all of our lives have changed to a certain degree since this thing has happened. You know what I mean? Extroverts are losing their minds. Introverts are having a great time. But everybody's life to a certain degree is affected, and this is nothing to take lightly. But in times of self-isolation, how do you think what is the best way for you to approach this? Because I was thinking, all right, let's watch some documentaries on pandemics last night, but then I was like, wait, what if I get too paranoid? But then I was like, I don't want to also stay too oblivious. Is so my question essentially is, should there be moral panic? Should there be paranoia? Or should we just stay calm?
I don't think there's time to panic. There's time to act, and the action would be to do social distancing. Now, me and you cannot keep on re-emphasizing the importance of this. Now, it's a very good time to isolate yourself within your house, be with your family members, and just to have the social interaction which was missing because everybody was on social media. Just talk to your father, talk to your mother, talk to your brothers and sisters, and do some reading, do some insight. And if you want, you can start some online businesses, have some ideas, be entrepreneur. But I think it's a great time. But what you don't want is be responsible for transmission of disease to your family. That's the key message.
Right. And Doc, I hope you're down to coming on the podcast again in regular intervals so that we can keep talking about the situation as it develops.
Absolutely. Yeah, we can keep on doing the updates.
All right, awesome. And you know what? I think we are going through a course of history, which is undoubtedly, something that we'll remember for the rest of time, for better or for worse, probably worse. But I think it's best, if nothing else, for us to look at this right now as a time of testing for the entire human race, because I think all of us are right now gonna have to come together with our collective will and a centered focus on how to solve this issue, and that is to think of yourself. And it's very I've been thinking about this philosophically for a few days. You have to kind of look within yourself to realize that you alone could help flattening the curve, in the sense that your efforts of staying home could definitely stop the spread of the disease, but also you have to kind of look past yourself, and think that it is not just myself that I'm doing this for, but all of society. Like a lot of people would think, I don't need to wear a mask because I don't have corona. First of all, you have no way of knowing you don't have corona, right? And second, unless you've gotten a test, which you probably haven't. And then second, the point of wearing a mask is not to protect yourself. It is to protect everybody else that you might be transmitting the virus to. So it is a time of introspection to look at ourselves as people who can definitely stop the spread of the virus. But also it is a time for, looking outwards and seeing everybody around you and realizing all of the things that we've taken for granted for so long are things that we need to now kind of come together to help solve. So I think it's very interesting time for all of us as human beings.
Very well said, Danny. And I've got nothing much to add except we all need to be responsible for our actions.
Yep, that's it. Great responsibility. Great power comes great responsibility, and we have the power to spread or stop this virus. Doctor, thank you so much for joining us. And I'm definitely going to have you on again. Okay, we'll just break the fourth wall. We're cousins. It's good to see you. and and I'm glad, I'm very happy for all the things that you're doing on the ground. And keep doing them, Doc. And we'll talk again.
Thank you very much, Danny.
No, thank you. Thank you, Doc.
Okay.
Ladies and gentlemen, this has been perhaps the most sad, but also I would say the most important episodes that we've done, primarily because we're not interviewing, a musician or a fitness guy or, an MMA fighter, or we aren't talking about, stupid stuff that we do for the basis of our entertainment. I am clearly not equipped to deal with this kind of a scenario. Because I have no medical expertise. I dropped out of science in like the 9th grade, and since then I haven't really been, close to the field or anything to that effect. But you know what? I feel as if it is my civic duty to try to get this out there, and I think it should be your civic duty to listen to what Doc just told us, and that is to, in so many words, in simple words, stay the F indoors. Do not leave your house. It is just as simple as that. Leave only for essential things. Wash your hands and sanitize them every chance you get. Stay far away from people and just distance yourself and try to look for symptoms and act on them. We're going to keep covering this as it develops, but for this episode, from myself and for Doc, this is Daniel Asim. And like always, even in these troubling times, I will say, keep it tight. Stay tuned. Thanks, Doc. That was awesome. Hello.